Hello everyone. Today we'll be discussing about the diet during pregnancy, the different vitamins which are useful during pregnancy. We have discussed the different states, the different complications, the different proximate principles, that is the protein, carbohydrate, fat, during pregnancy, the minerals, and today we'll be discussing the different important vitamins which is required during pregnancy. Welcome to Educatus. You all know that myself is Mandishta Chatterjee. Let us discuss today's topic. Now, vitamin, as you all know, are of two types. One is the water soluble vitamin, another one is the fat soluble vitamins. Now, the water soluble vitamins, under water soluble vitamins are the vitamin B group, that means all the B vitamins, and vitamin C. And under fat soluble vitamins, we have vitamin A, D, E, K. So, first we'll be discussing the need of vitamin A, D, E, K, that is the fat soluble vitamins in pregnancy. And then we'll be discussing the need of water soluble vitamins during pregnancy. First, coming to the most important vitamin, that is vitamin A. We all know that vitamin A is required for growth, differentiation of uh, numbers of the cells and tissues, and it is throughout required during the breastfeeding period. It helps in the development of the fetus and the newborn, and that's why it protects the natural eyesight of the child. That's why vitamin A is very important. So vitamin A in normal, according to RDA 2020, in normal women, sedentary, moderate and heavy, it's given around 840 mg per day, which during pregnancy is increased to 900 mg per day. So, vitamin A can be given through different fruits like peaches, papaya, mangoes, all the reds and yellows in the diet. That means a colorful table, a colorful plate will help to achieve the vitamin A. Mangoes, pumpkins, carrots, melons, all these are good source of the beta carotenes which will be transferred into vitamin A, and retinol, vitamin A itself as fish and eggs and milk. So that has to be given in the mother's diet in ample amount so that the vitamin A can be fulfilled. Coming to another important vitamin, that is vitamin D. Vitamin D is required to get out of the uncomplicated pregnancy, to give rise to a healthy full term baby, and also to develop immune system. It all vitamin, again, you we have discussed in the previous video that calcium, phosphorus is very much required for the baby's bone development, teeth development, especially in the third trimester, and vitamin D helps to balance and maintain the adequate levels of these minerals. So vitamin D is also very much important. It also decreases the risk of the autoimmune diseases, and for later life, for good bone health in the womb, like if the what we can see, if the base is good, then the building will also be good, right? So if we can make the base of the baby with good vitamin D, then the baby will grow better, and good mental health will also be seen in babies with good vitamin D. Cheese, margarine, butter, it's better to avoid margarine, cheese, butter, fortified milk, and fatty fish. They are good sources of vitamin D. A normal level of 600 IU per day international unit is given throughout the life of a sedentary, moderate, and heavy women. No extra is required during pregnancy. It should be maintained thoroughly. Coming to another important fat soluble vitamin, vitamin E. As you know, it's an antioxidant and it helps in reducing the free radical damages which can harm the cells, organs, and tissues. It also helps to balance the level of prolactin. In the first video in this segment, in this whole pregnancy menu, we have learned about the different hormones that is related to the pregnancy, that is the prolactin hormone. The female reproductive system needs to function well, and vitamin E helps in that. And also vitamin E helps to maintain the lipid levels of the body. Blood circulation in the mother is improved by vitamin E, especially when the blood circulation is good, like good amount of oxygen will be moving in the placenta, and the healthy womb environment is maintained with the help of vitamin E. Vitamin E is good in the seeds, especially in the sunflower seeds, nuts, good. Green olives, if you can have, that is good. Spinach, avocado, apricots, these are good sources of vitamin E. Vitamin K deficiency, if there is vitamin K deficiency, which can be due to some maternal medications, like medications having um, carbamazepine or phenytoin, these group, or warfarin group. If drugs containing these groups are there, sometimes what happen, there can be vitamin K deficiency in the child, leading to bleeding in the infant. Or sometimes there is improper transplacental transfer of vitamin K, and vitamin in that results in the limited amount of vitamin K stored in the body. And also keep in mind that breast milk is also a very not a very good source of vitamin K. So mother's diet should be rich in vitamin K rich foods, like the liver, cheese, over here egg, nuts, over here different kinds of, over here it is prunes, different kinds of vegetables, especially the green leafy vegetables, broccoli, etc. Coming to the B vitamins now, B vitamins and pregnancy, but I have also specially focused on this picture. If you just can focus on this, this is a very good picture I got in the net, and this shows that vitamins, nutrition, and hydration, these are essential during pregnancy. So before discussing the B vitamins, I want all of you to focus on this, that vitamin, nutrition, and hydration. So that means we have to not only think about the food but also the liquids. That means the hydration is also very much important. To remain hydrated, at least 10 glasses of water or in forms of fluid can be given to the mother. Exercises are also important, like as given by the doctor. A nutritious balanced diet, which I've been like telling throughout the video, that a nutritious balanced diet has to be given, because each and every nutrient is a part of the pregnant diet, and that has to be given through the diet. Iron, calcium, these are main. Along with that, an important ingredients in the prenatal vitamin is the folic acid. So if we can take a capsule, like if you think our pregnancy diet to be a capsule, that capsule should contain a diet, proper water intake, exercise, and definitely iron, calcium, and folic acid. And how long will you take this capsule? It should be at the time or before conceiving, and throughout pregnancy, even while breastfeeding. So this is what I found very good, a nice way of presentation, and that's why I thought of sharing with you. Now let us come to the different B vitamins and the different functions of them during the pregnancy. Thiamine, vitamin B1, they plays a very important role in the baby's brain development. Vitamin B2, riboflavin, helps the eyes healthy and the skin too glowing and fresh. Niacin improves the digestion. As we have discussed, that morning sickness is a very important problem during pregnancy. As we have also discussed this, that it is not now called as a morning sickness because this problem is seen throughout the day. So niacin can be one of the important vitamin B vitamin which can be given, and it has seen that after taking niacin, the conditions has improved. Pantothenic acid, pregnancy cramps and cramps which is resulted during due to different kinds of pregnancy hormone, that can be eased due to with the help of pantothenic acid. Pyridoxine, pyridoxine plays a very important role in the baby's brain development and nervous system development. So I have just what I have done is that I have just written all the benefits at one place so that we can actually discuss them at one go, and then we will be discussing about the need of them and the different food items which have them. And biotin, pregnancy causes biotin deficiency, so biotin deficiency can be improved by a proper balanced diet. Folic acid, as I've discussed in the previous video, now also I've told you that it is very important because it helps in the neural tube formation of the child. And cyanocobalamin, which is vitamin B12, it also helps in the baby's spine and the central nervous system development. So the main part, development of the main part of the body uh, is done by vitamin B12, vitamin B9, so vitamin B1. So focus on those B vitamins are very, very important. So coming to this slide, where what I have done is that I have tried to focus on the most important B vitamins and their rich food source, and also have focused on the different need of the particular vitamin. Like as you can see, if you're talking about thiamine, the sedentary need of this thiamine is 1.4. Moderate need, like for a moderate woman, it is 1.7, and the heavy need is 2.2. But pregnancy need is 2. So at least 2 milligram per day. So if a sedentary woman during her normal days is taking 1.4 milligram per day thiamine, then the amount has to be increased to 2 milligram per day on the particular vitamin B. So how she can increase it? By inclusion of beans. Those who can take beef can take beef, oranges, oats, green peas, and sunflower seeds. As I told you, sunflower seeds are very good for the body. In previous slides also I have discussed. Now coming to the second, riboflavin, that is also very important. 1.9 is the sedentary need, 2.4 is the moderate need, and the pregnancy need is about 2.7. So we have to increase the amount with the help of these food sources like the milk, oyster, egg, mushrooms, liver. So this can actually increase the help of the riboflavin. Niacin, niacin, whatever is the requirement, that it can be sedentary 11 milligram per day, moderate 14 milligram per day, heavy 18 milligram per day. During pregnancy, the rise will be plus 2. That means if you are taking 11 milligram per day, 13 milligram per day will be the niacin requirement, and it can be achieved by the poultry, meat, fish, mushrooms, spinach, meat, etc. Okay, liver, etc. Now vitamin B6, as I told you, it's also very important vitamin. The rise, like for sedentary and moderate, is almost same, 1.9 milligram per day. During pregnancy it rises to about 2.3 milligram per day. And the requirement, you can have it through garlic is very good. Sunflower seeds again, egg, fish, meat. So the videos that you are seeing, the different food sources, you see egg has something. Egg is the one which is everything. Okay, so egg can be given, and egg has to be given, included in the non-veg pregnant mother diet. I have to specify that. Okay, so these are the vitamins which are very much required by the body during this time, and these are the food sources, the B vitamins, which are essential for the baby's growth in our body. Now the B vitamin 12, the vitamin B12 rather, sorry, the rise is about 2.2, and during pregnancy the requirement is about 2.2 mg per day, and the requirement increases about 0.25, and you can get it through clams, mutton and chicken, all, please, vitamin B12, all animal sources, eggs, milk and dairy products. Now folate, again I have, as it is so important, I have just again shortlisted the different important functions of folate. Like it helps to helps the cell to grow and multiply, keeps the brain healthy and nervous system healthy. It also helps the brain and development of the the infants during pregnancy, forms the red blood cells of the baby, balances the homocysteine level, and also forms the genetic material. How much it is required? See the folate requirement. It is 220 mg per day for the normal time, which rises to about 570 mg per day during the pregnancy. And the IFA tablet, if it is not changed, if it is as the old, it contains 400 mg. And over here there are some few sources of folate, like the salmon, the mustard greens, beets, soybeans, avocado, eggs, again as I said, peas, whole grains, spinach, brussels sprouts, citrus fruits, etc. Now I'll just tell you these things, that all the requirement or all the RDA that I'm showing now, it is all based on RDA 2020. Now vitamin C is also very important, because first and foremost, which I was discussing in the minerals video, that vitamin C helps in the absorption of iron, especially from the veg sources of iron. And vitamin C is required because the structural protein, that is the collagen, it helps in the component, which is the component of the cartilage, tendons, bones, skin, etc. It helps in the formation of that. It is also helps to maintain the healthy immune system, wound healing, repairs, healthy skins, and also a potent antioxidant. So vitamin C requirement is very much required and needed. So through the requirement, normal person has 65 milligram per day, which increases to about 15 plus 15, that is around 80 milligram per day during pregnancy. So all the citrus fruits, along with that papaya, grapes, cabbage, they have good sources of vitamin C. Now, with this, we come to the end of all the required RDA for vitamins. In the previous videos, we have discussed about the uh, minerals, we have discussed about the proteins, we have also discussed about the different the pregnancy need, the changes during pregnancy. And as you can understand that we have discussed so many things in short videos. It is such an important uh, concept and such an important thing to discuss. Now, why I have now you will be thinking that when everything has completed in this chapter, then why I have written to be continued. I have written to be continued because we will be doing one balanced diet. Like I have been telling you that these are there, these food have these kind of vitamins, minerals. But when we combine and when we try to make one like a proper day's meal for a pregnant woman, how can we give and what we can give, we can discuss about that. We can discuss about the food pyramid of the pregnant woman, and we will have a short discussion on that, a short video on that. And after that we'll be completing, we can complete rather the pregnancy chapter, and the pregnancy videos will be complete in my playlist. Like in Educators, if you can check the pregnancy playlist, you will get all these videos one after another. And if you want to go through these videos, please go through the playlist, because in playlist one after another you will get all the videos, and these videos are linked up with one another. So please go through, and that will help in your uh, studying as well. So let me discuss the diet portion with you tomorrow with another video. But if you have any confusion in understanding, please don't forget to message me. Please write comment that I haven't understood a particular part. And if you want me to make this videos in both the language, like if you want me to discuss these things in Bangla too, then I will definitely try to do it. So please give me response regarding the same, because your response matters a lot. So thank you. That's all for today. I know you people are there with me, and don't forget to like, share and subscribe Educators.